Please remember, one of the questions which people ask me is, so if I take the vaccine, I will not get the flu. There is no guarantee. The vaccine induces the body's immunity against that specific virus and brings it to a level whereby for at least about 70-80% of the time it can prevent the flu. But even if you get the flu, it minimizes the severity and it prevents the complications. So a lot of people, no, I take the flu, but it will guarantee that it will protect. There are no guarantees. But this is the best alternative we have in preventing or suffering the complications of the flu. So the flu vaccine contains, usually the currently available vaccines contain 4 strains. You know, influenza or flu can be of different types, A, B, C and D. D generally doesn't cause problems in humans. A is the commonest strain of viruses which causes severe pandemics. B can also cause severe infections. C, very mild infections. So the flu vaccine contains 2 strains or 2 types of influenza A virus, 2 types of influenza B virus. So it's a quadrivalent vaccine. 4 strains or 4 types of viruses, 2A and 2B are in this. These are usually the circulating ones. So by injecting the flu vaccine, it stimulates the body to produce antibodies against these viruses. So when the flu hits you, the body recognizes it early and immediately kicks it out of the body, or at least makes it so weak that it does not cause complications. That is how the flu vaccine works. So it takes at least 2 weeks for the antibodies to be built up. Don't think that if you take the vaccine today, tomorrow you are immune to the flu. No, it takes at least 2 weeks, so take it at the earliest. The problem is these antibodies wane.
Is the evidence suggesting about influenza and its implication? It clearly shows that if I take a high-risk population, which doctor just defined, that typically elderly patients more than 65 years of age, patients with comorbid conditions, can understand disease like asthma and COPD. If these patients are vaccinated with influenza vaccine, there's a 50% less chance of hospitalization if they are infected with influenza. So that is a protection what a vaccine can offer to this high-risk population. Now coming to children less than 5 years, we always advocate that children less than 5 years should be taken influenza vaccine. It has been seen that if these children are vaccinated, there's a 57% reduction in the risk of hospitalization if they are infected with influenza. Now most importantly, for a pregnant woman, if they are vaccinated, there's less likely, almost 20 to 30% less risk of a preterm birth in a pregnant woman. So these are the patients who falls in the high risk category and need to take a vaccination. So we do understand that any patient with influenza, if they are vaccinated, it prevents all the complications. But still, there are a lot of barriers as to why vaccination is still a challenge out in India. First and foremost, the most important barrier is that influenza or flu, as Dr. rightly pointed out, is still being perceived as a minor self-limiting disease. The patient would get the disease on one day and at a point of time it will just go away. But please note, influenza is caused by different strain of viruses. It is the H3N2 or the H1N1. Globally or in India, it is a major public health concern because in these patients who get influenza, if they are not well protected, they can lead into complications, they can end up with hospitalization. The second important barrier when it comes to influenza vaccine is that there is a lack or less knowledge or awareness about this particular disease or the role of vaccination amongst the doctors. We have a doctor who takes an annual vaccination, but believe me, there's a lack of awareness amongst the doctors as well as the public. So due to which the importance of taking a vaccination becomes a little self-limited. And especially in the high-risk population, we spoke about elderly patients, patients with diabetes, cardiovascular, renal disease. The focus out there is more towards the treatment rather than prevention. And herein, it is very important that these patients understand that vaccination would actually help them to prevent the complications of influenza.